Okay, now, all right, ready to go.
Okay. Hi. About a week ago, I did a video, which you just see my bottom leg. I'm a 70-year-old man that was in very good physical shape. I'm 6'3". I weigh about 210 pounds, although I wound up losing a couple pounds, but I have a feeling I'm starting to put it back on again. I was on a cruise ship, and when we were walking ashore, I stepped on some very uneven concrete, and I fell forward, and I actually fractured my patella in 3 places. And when I came home, they immediately did surgery, which included two pins, and then they have some crossing thread. Now, initially I was on a wheelchair. And then I graduated to crutches. I found crutches were very good. And then I went directly from having 2 crutches to 1 crutch. And it's very good to learn, by the way, how to properly use a crutch, because a lot of people don't know how to use it. So, ask your doctor how to do it properly. I never liked using a cane. I didn't find it gave me any stability. Now all of a sudden, that from the last week or so since I did this video, I've improved quite a bit, and now seeing the doctor today, I was able to take off my black mobilizer, which was very, very onerous because it's like 4 sections holding you in, and you can move around, but it's very uncomfortable, and it gets hot. It's just no fun having to wear that. Now, apparently, you can remove sections, but apparently you still have like pieces sticking out. So my doctor finally cleared me and said, I'll tell you what, you're far enough along. If you want, just forget about wearing the mobilizer now. And it's made a big difference today now that I've been able to take that off. Now, the last couple of days I've been doing some pre-physical therapy because I'm going to be starting physical therapy in the next day or two. But some of the things, if you're far enough along, and if you don't feel pain or anything, is you can raise your leg, do stiff leg raises like this. Another one that's good that I've seen is you go back and forth, you raise it up only to the point where you feel comfortable like this. And the other one that's very good is you pull forward and you stretch out your entire bottom of your leg, and then what you can do is go back and forth with your leg. And this is all the whole idea is you want to work your calf muscles and your frontal muscles, because all this stuff is atrophying from lack of use, and you can't help it. And what I also have is I have a band, which is like an exercise band, which you can hold and you can have some resistance training. Now I expect I'm going to start now with physical therapy, and I expect that they're going to start me with using bands also, and they're also maybe starting me with recumbent bicycle, which is what I've been told is good. I also have where I live, I have a new stepper, but they're not as good supposedly. Outside of that, my diet hasn't changed much. I find that I use some muscle milk because that helps to help you regain some of your muscle. Because one thing you do see is you do start losing some muscle. So even though the last couple of weeks, even though I can't do anything with my leg, I have been going to the gym and doing some upper body things. The idea is keep as active as possible, but within, because you want to allow your leg to heal. You don't want to start doing things and allow your leg not to heal. But anyway, I'll continue making these videos, and I'll keep you posted on my progress. And good luck if you've had a similar injury.